It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Grace Sells, and welcome back to another edition of the Best Docs Network, which of course features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And speaking of helping change people's lives, Grace, we're going to kick off the show with just that.
That's right, Jim. We're going to see how Charla was able to overcome her excessive weight gain battle with help from bariatric surgeon from My Bariatric Solutions, Dr. Scott Stowers.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charla had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at My Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before. Experienced some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there and tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe 1 every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
So before I met Dr. Ducic, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducic does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
The goal is not to do surgery. The goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often.
Your skin is the largest organ on your body, and taking proper care of it is vital. Let's hear Dr. Clay Cockerell educate us on how to care for your skin and scalp during every stage of your life.
Most people don't realize, but the largest organ in your body is your skin. Without your skin, you actually can't live. And there are some people, unfortunately, who do have serious problems where they lose large areas of their skin and they actually have a very tough time surviving. How do you take care of your skin? It's a good question. It sort of depends upon where you are in your life, for example. Obviously, if you're a little baby and you can't take care of your own skin, you need your parents to make sure that they change your diaper frequently and use moisturizers and keep it from getting an infection or an irritation. As you get older in your teenage years, you need to make sure that you take care of your skin that may be too oily and whatnot. You may be prone to acne, so you need to wash your skin and use appropriate acne medications and things like that if necessary. As you get older, you need to make sure that your skin doesn't get too dry. So you don't want to bathe too many times with harsh soaps and waters, and your skin can get dry and then develop rashes. And then all throughout your life, you want to make sure that you don't get too much sun exposure that can lead to skin cancer and melanoma. As our skin gets older, especially if we've had a lot of sun exposure, our skin loses the elasticity of the skin. It becomes, instead of when you're a little young person, if you pull on somebody's skin, it kind of bounces right back and goes back to normal. As we get older, if you do that, it takes a little bit longer for it to go back, and then as time goes on, you start getting wrinkles and your skin loses a lot of that sort of tensile strength that it once had. A lot of that is normal aging, but if you go out into the sun, it's much more accelerated. The scalp can be the site of a lot of conditions also, and if you've never had any disease in your scalp, you might not think about it. Probably the most important one is what's called alopecia. If you're losing your hair, especially if you're a woman that has got a lot of hair, or even if you're a male that you're going bald. I mean, that's really distressing to a lot of people. In addition to that, there are a lot of inflammatory diseases that can affect the scalp. Folliculitis, psoriasis, seborrheic dermatitis, and then there are some really sort of terrible diseases that sometimes can get into the scalp. There's a thing called dissecting cellulitis, which can cause really large, boggy areas of inflammation, and pus can drain out of the scalp. It's almost like severe acne, but it just affects the scalp as well. So if you do have something up there, that's probably a good idea to get checked out by a dermatologist, and they can make a diagnosis for you, and then it can be treated appropriately.
Coming up next, learn about the different types of chest pains and how they affect your body during our Medical Minute.
Plus, hear how dealing with stress will promote a healthier lifestyle. All this and much more when we come back. Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prostodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my professional experience, I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The Aspen after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because that's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it so that the antibiotics can't eradicate it. What the Aspen After Surgery treatment does is an ultrasound device specially designed for the breast that imparts energy and to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
Chest pain can be a scary thing. There are bad causes of chest pain and not so bad causes. So how do you know the difference? Well, generally the bad causes of chest pain, for example, a heart attack, occur with a gradual onset. For example, the discomfort comes on gradually and then goes away gradually. It's usually exertional when you do things like run up a flight of stairs. It's usually dull, not sharp, and that means not like a knife. Knife-like chest pain doesn't tend to be heart-related. Also, if it's heart-related chest pain, you'll tend to get other symptoms like shortness of breath, you'll get a cold sweat, you might even get nauseated or have the pain go to your jaw or to your arm. Now, non-heart related chest pain is a lot easier to figure out and yet not nearly as scary. For example, it's usually sharp, it's usually sudden, it's usually aggravated by motion. For example, if you have chest pain that's worse when you move or reach or bend or arch your back, that's generally muscles or nerves, and that generally lasts longer. So that's the way you can figure out whether it's heart or not heart, that and whether it's exertional. You go up a flight of stairs and your chest pain gets worse, and that's pretty predictable every time you go up a flight of stairs, that may be your heart. Check that out, especially if you're older.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Don't forget, for more information on any of our outstanding doctors, head to the website, bestdocsnetwork.com, bestdocsnetwork.com. You can even request an appointment.
That's right, Jim. Now up next, we're going to see how Jennifer was able to achieve similar results to a facelift with non-surgical treatments from Dr. Naila Malik.
Aging is a multi-dimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
Still to come, see how plastic surgeon Dr. David Azouz treated one man with enlarged male breasts.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier that came here to get it fixed. Because they're more desperate sometimes than the people who had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, and she's talking to everybody about it. And so I love that. And getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
75% of Americans experience foot pain sometime in their life. Carrie was one of them. But right now, let's take a look on how she eliminated heel pain with one of the latest technology procedures called EPAT.
Plantar fasciitis is actually just inflammation of the plantar fascia, which is the large ligament on the bottom of your foot that goes from the base of your heel to your toes.
I was doing fine until I kind of changed my routine, started running again. For the longest time, didn't really feel any heel pain, and then all of a sudden, just really sharp pains, after I'd be done.
The more common signs or symptoms are pain with first step in the morning, pain after being on your feet for extended periods of time, or even later in the day, pain after taking short rests and getting back on your feet.
I started with some treatments, started with, just doing cortisone shots, did a series of those, as many as you can, which is about 3 shots. That didn't work. Then I said, okay, well, let's just try, physical therapy. Did physical therapy for several weeks. That didn't really work. And so we came to doing this treatment.
EPAT is, it stands for extracorporeal pulse activation treatment. It is a highly effective, non-invasive treatment performed for plantar fasciitis. It works basically by a set of unique pressure waves, and what it's doing is increasing and enhancing circulation to the area and promotes the healing and speeds up the healing process. It's performed in the office. It generally takes 3 treatments, which we do 1 treatment per week for 3 weeks. Has a success rate of over 80%, and there is really no downtime or risk with the treatment at all.
When you come in, you're here maybe half an hour, and the treatment probably takes 10 minutes at the most. You know, but by the time they set everything up, you get in and out, you're in and out in about half an hour. So, you know, as you're coming through, you do 3 or 4 treatments and then you're typically done. So I've had 3 and I'm on my last 1 round.
She's done very well. In fact, I think she's back to most of her activities and really is pretty much pain-free.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of, you know, take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to, you know, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, you know, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
What we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, you know, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
We saw a lot of wonderful doctors on the show today, but that's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives. And remember, if you have a question, comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
And for more information on any of these outstanding doctors, of course, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. So long, everyone. We will see you next week.